Today, we will be talking about neonatal hypoglycemia. So first of all, what is hypoglycemia? Let's break down this word. Hypo means low, and glycemia is a term used to define blood sugar levels. When there is not enough sugar, also known as glucose, in the blood to provide our bodies the energy needed to function properly, we call this hypoglycemia. When a newborn infant's blood glucose is low, this is termed neonatal hypoglycemia. So why does hypoglycemia occur in a newborn infant? To understand hypoglycemia, we need to first look at how sugar is able to enter the cells of our bodies from the blood so that cells can get the energy they need. In order for this to happen, we need insulin. Insulin acts as a key. While sugar is floating in the blood flowing throughout the body, insulin attaches to cells and opens gates, allowing for sugar to enter the cell. Once sugar is inside the cell then turns it into energy, allowing for the cell to continue its normal activity. However, sometimes there are too many keys or too much insulin. If there's too much insulin in a body, a lot of sugar enters the cells and gets eaten up very quickly, but not enough remains in the blood for the rest of the body. This leads to hypoglycemia. Well, what typically causes hypoglycemia in newborn infants? Hypoglycemia can be seen in infants of diabetic mothers, if there's low oxygen at birth, if they're born early, born small in size, if there is a low birth weight, if the infant's in distress, and some maternal medications can also cause hypoglycemia. The most common cause of hypoglycemia is due to high levels of insulin. Let's talk a little more about insulin. One important thing to note is that while sugar can easily cross the placenta from the mother to the fetus during pregnancy, insulin cannot because it is too big to do so. So, when a mother has high amounts of sugar in the blood, a high amount of sugar crosses to the fetus. Because the mother's insulin does not cross the placenta, the fetus creates its own insulin to match the amount of sugar entering its body. If there is a high amount of sugar entering the body, the fetus will match that with a high amount of insulin. During delivery, the mother's higher supply of sugar suddenly stops reaching the infant. However, the infant is still used to producing the higher amounts of insulin. When there is not enough sugar to match that, the infant experiences neonatal hypoglycemia. It may take a few days for the infant's insulin levels to get better. So how can we tell that an infant has hypoglycemia? Signs of hypoglycemia include jitteriness, weakness, tiredness, floppiness, turning blue, breathing fast, a temporary pause in breathing, poor feeding, and sometimes seizures. However, many infants also have no symptoms. It's always important to look for other causes of hypoglycemia, like an infection. Well, how can we tell that it actually is hypoglycemia? Blood sugar is checked with a special machine that requires sticking the infant's heel for a drop of blood. This can be done in just a few minutes right at your infant's bedside. Sometimes a second check is needed to make sure that the first reading is correct. So what do we do when there actually is hypoglycemia? Feeding human milk or formula is usually the first step in treating hypoglycemia. A blood sugar will be checked again to make sure that this treatment works. If the infant's blood sugar does not rise or the first reading was very low, sugar may be given through an IV directly into the blood. This can be slowly turned down over the next few days depending on the blood sugar readings, while your infant eats more, or as insulin levels naturally drop, making it safe for you to take your baby home.